Just like we have to hold it like this or like this, okay, or like this. So what are the features here? The features are iliac bone, then we have a pubic bone, then we have a ischium bone. Okay, the ilium bone is all this up till this level is the ilium bone. It has an iliac crest. It is palpable. Iliac crest has an inner lip, medial lip, outer lip. It is S-shaped. It's S-shaped. Okay, slightly turning. Okay. On the outer lip we have tubercle, iliac tubercle. This corresponds, if the person is lying like this corresponds to L3-4. If you find this, L3-4 is very easy to locate to get the specimen for CSF. This is one of the importance. Plus, iliotibial tract, we will do it tomorrow. Iliotibial tract is attached from here and it goes up till the knee. It is a thick part of the thick fascia of thigh. Fascia of the thigh is still thick, and the thickest part of this is known as iliotibial tract or iliotibial back. So we will do it. Then we have anterior border, posterior border, and a medial border. Okay, anterior border features are anterior superior iliac spine, anterior inferior iliac spine, and it will go towards the acetabulum.
Can you show it?
Yes, it will go towards the acetabulum. Then the posterior border has posterior superior iliac spine, posterior inferior iliac spine, and it will continue as a notch, and it will reach into the greater sciatic notch, and it will even reach the iliac spine, ischial spine, sorry. Then after that we have ischial tuberosity, but wait. Then here is the medial border. Anterior border, posterior border, medial border. This is also known as blade sometimes, iliac blade. The medial border is considered from here up till this part of elevation, or known as iliopubic eminence. Iliopubic eminence. And it continues as arcuate line here. Okay. Now, it divides the border into, this border divides the iliac surface into two parts: iliacus surface, iliac fossa, and sacropelvic surface. The sacropelvic surface has a rough tuberosity, iliac tuberosity, and a ear-like auricular surface. Here, auricular surface. Outer, we have gluteal surface. Gluteal surface has three lines, if you really feel them. This is a posterior line, here. Here we have anterior line, and here we have inferior line. Gluteus maximus is attached back to here. Medius is between these two lines, and minimus is here. Okay? Then,
here is the third place.
yeah, sure. This is the outer surface. This is the outer surface, okay? Outer surface has three important lines. Sometimes they don't have line, they have empty areas like this. So if I even keep it here, so, and here, so this is the outer surface. On the outer surface we have posterior line, then we have anterior line, and then we have inferior. Good?
Yes.
Then we have acetabulum. Okay, let's finish the bone and then acetabulum and obturator. Then we have pubic bone. Pubic bone has different structures. Number one is the body of the pubic. Now my hand covering the body of the pubic bone. It has one ramus, superior ramus. All this is ramus. It has an inferior ramus. The inferior is continuous with the ramus of the ischium. So this is also known as ischiopubic ramus commonly. Here is the superior ramus of pubis. In the body of pubis we have, of course, anterior surface and posterior surface. The important feature is here pubic tubercle in the front. Pubic tubercle is a landmark for the attachment of inguinal ligament, which is attached from anterior superior iliac spine to the pubic tubercle.
Can you show it here?
From here to here. This is the attachment of pubic tubercle. Inguinal ligament, sorry. Here is the pubic tubercle. Here is anterior superior iliac spine, and we have a ligament attached like this, the hard good ligament. What happens is the structure above it, for example, external iliac artery, when it will cross this ligament, now in the lower limb it will known as femoral artery. Similarly, femoral vein coming here, after crossing, it will become and be labeled as external iliac vein. Good? Of course, then we have femoral vein and all up. We will see in the thigh, no problem. Then, okay, pubic tubercle. Here is the ramus. Here. This sharp border is known as pecten pubis.
What, doctor?
Pecten pubis. Just the name. Or you can see superior border. Then we have anterior border. Then we have inferior border. Good? This is for the ramus. For the body, I will repeat again: anterior surface, posterior surface or pelvic surface, medial surface. Medial surface will make symphysis pubis. It will make a thin hyaline cartilage and then a fibrocartilage, and then we will have another hip bone here to make a hip girdle, and this is the fibrocartilaginous, secondary cartilaginous type of the joint. Then we have obturator foramen. Okay, let's finish the pubic ischium first. The rough posterior part of the bone is ischium bone. This. It has various parts. The ischial spine. The ischial spine has some part of ischium here because the pelvic surface of ischium is also included here. Here is the greater sciatic notch. Greater sciatic notch. Then you have ischial spine. Then we have ischial tuberosity. All this rough surface is ischial tuberosity. And then we have ischial ramus, which is actually attached with the pubic ramus, so ischiopubic conjoined ramus or ischio.
So what is the lesser sciatic?
Greater sciatic notch, lesser sciatic notch. This one, lesser sciatic notch. Obturator foramen. Obturator foramen is covered with obturator membrane, with obturator internus muscle on inside, obturator externus on the outer side, mainly, and the border. Once it is attached, even we have a pathway here, like this. This is known as obturator canal for the passage of obturator nerves and vessels into the medial part of the thigh. Obturator nerve is the chief organizer for medial compartment of the thigh, pectineus and other muscles. We will do in the lab, inshallah. This is obturator foramen. It is triangular in males and bigger. The obturator canal.
The
Superior ramus. Okay. So here is the body of the pubis. Here is the superior ramus of pubis. It has an upper border. It has a anterior border. It has an inferior border. It has a pelvic surface. The body has anterior surface and a posterior or pelvic surface and a medial surface or symphysial surface, no problem. Plus there is a pubic tubercle on the body. Khalas? Obturator foramen is bigger and triangular in males. Then it will give you a pathway here for passage of known as obturator canal, even if there is obturator membrane. Obturator internus muscle is attached here in the inside. Obturator externus is attached here on the outside and also with the margin. Then we finish this. Okay. Then we have acetabulum. This all is acetabulum. Acetabulum. What is acetabulum? Acetabulum is the part that fit the head of the femur here. Inside, if you see, it has a C shape or horseshoe shape articular surface. The whole of it is not articular like in glenoidal shoulder. No. Here is a pad of fat, and this can be separated, demarcating a C shape or a horseshoe shape articular area. This articular area, and this inner line, here we have fat, pad of fat. Of course, this is intra-articular, but the fat And let's see this notch, how it is bridged up. So this is the margin of the acetabulum. It is deficient here. So there is a ligament, transverse acetabular ligament, which will fill the gap. Then here we have non-articular part, which has fat, and here we have articular part. It is good deep enough, but still to make it more deeper, we have a good thick labrum, like we have a glenoidal labrum for shoulder. Here we have a acetabular labrum, fibrocartilage ring, which will make it thick or more deeper for easy handling of the head of the femur. Good. Then we have a capsule. On the inner side of the capsule, we have synovial membrane, and synovial membrane has some communication with bursa here. We will see when we will do the joints. We have not done the joints yet. Any queries about the bone now? See the anatomical position of the pelvis. It's not just like this. No. It's like tilted in front. It's a girdle now. I don't have the sacrum and coccyx. So two of them, when they combine, we call them as pelvic girdle. Okay. So if I keep it, think if it's a pelvis, it's not straight like this. It is like tilted in front. So that the pelvic inlet, false pelvis, true pelvis, you have done it.
Yes,
True pelvis, then pelvic inlet and a pelvic outlet. This is known as pubic arch. It is like 90 or less in males, and it is like 120 like in females. So try to remember like this, like here and like here. We have again other differences like in the hip bone, especially this one, the arch, the heaviness of the bone, the roughness of the bone in originals. We do have different, but keep these differences with the pelvis as such. Khalas? This is, I hope, done. Okay. You can continue or stop it, no problem.
Okay, we'll
Stop and make another one, so that